Is it recording? I think it is. Okay. This is my ID. Can everyone wave to the camera, please? Awesome, thank you. Okay. Okay. Imagine not being able to breathe. You're grasping for air, you're coughing and wheezing, and your anxiety and heart rate is rising. Your airways are tightening and it feels like you're drowning or an elephant is sitting on your chest. What you're experiencing is panic-inducing and life-threatening. What you're experiencing is an asthma attack. I'm here today to inform you all on the pathophysiology of asthma. By the end of my speech, you guys will be able to detect symptoms of asthma, avoid any possible triggers that could initiate an attack, and be educated on different treatments for asthma. I've had severe asthma since I was born throughout my childhood. I've had multiple pulmonary checkups, visits to the ER because of an asthma attack, and have experimented with multiple types of treatments and medications. Now that I'm older, I still experience flare-ups, but I've learned how to control it and I know how to react when an asthma attack is about to occur. I'm also a biology major in pre-pharmacy, so I find pathophysiology and like anything in healthcare very interesting to learn about. I will go into further details of the causes, symptoms, and treatments for asthma. First, I will discuss the causes of asthma. First of all, what is asthma? Asthma is a chronic or long-term disorder that affects the bronchi or the airway tubes in your lungs. Asthma causes your airways to become swollen and inflamed, making it difficult for you to breathe. You can see on my first slide the difference between healthy lungs and asthmatic lungs. According to Britannica, a common trigger for asthma, especially for kids who develop asthma in their childhood, is due to allergens. Allergens include pollen, dust, or food. For example, I have a lot of allergies, such as seafood, and the steam produced when cooking seafood, it causes my airways to start closing, and eventually that asthma attack can evolve into an allergic reaction or even anaphylactic shock. Britannica also states that in adults who still have uncontrollable asthma, a common trigger is weather changes or rhinitis. Last December, due to cold and harsh weather and winds, it triggered my asthma and I actually had to be brought to the ER and admitted into intensive care unit. I was put on a BiPAP machine because I was unable to breathe with my lungs alone. And eventually they diagnosed me with rhinitis, which is just a fancy way of saying common cold, which a lot of people usually get during cold season and pollen season. Mayo Clinic mentions that other triggers that can cause asthma to flare up is exercise-induced asthma. For me, cardio workouts or anything fast-paced are very difficult for me. There's also occupational asthma, which means workplace irritants such as chemical fumes, gases, or dust. Personally, strong perfumes or cigarette smoke can trigger my asthma. Next, I will be talking about the symptoms of asthma. According to Mayo Clinic, the most common symptoms of asthma include shortness of breath, chest tightness or chest pain, wheezing, and coughing. Mayo Clinic also points out that your asthma may be worsening if your symptoms are more frequent or prevents you from completing everyday tasks. Scientist Alison Insero, she studied how COVID cases affect asthmatic people. She explains that people who are immunocompromised to COVID include people with heart conditions, diabetes, obesity, but also asthma. COVID can worsen the symptoms of asthma and become life-threatening. Lastly, I will be discussing the treatments for asthma. Britannica states that the asthma medications categorized into two different medication types. There's anti-inflammatory drugs and bronchodilators. Bronchodilators relax and expand your bronchial wall so that there's less constriction. The most common route for respiratory drugs are inhalation drugs. There are three types of inhalers that you can view on my last slide of my PowerPoint. There are rescue inhalers that provide immediate relief and contains corticosteroids that dilate your bronchial wall so that, and it also increases your heart rate. I keep my rescue inhaler. This is my little rescue inhaler. I keep it on my keychain and I always have one with me like at all times in case there's any emergency because you never know. Next is nebulizers that they administer medication in a mist form that you can inhale. And lastly, there's a maintenance inhaler, which is an inhaler asthmatic patients take on a daily basis. The CDC, or the Center of Disease Control and Prevention, provided some recent stats on how asthma has been affecting the population of the US. 42% of asthmatic children still experience asthma attacks regularly, and 41% of adults still experience asthma attacks. And the mortality rate due to asthma attacks was shocking. 2.8 of children have died due to asthma attacks, and 15% of adults have died. To conclude, you are all now knowledgeable on the causes, symptoms, and different treatments of asthma. I believe knowing this information will be valuable and beneficial, and who knows, maybe you can even save someone from experiencing an asthma attack or prevent one from happening. Thank you. Does anyone have any questions? You can raise your hand if you do. Chance.
I have a question.
Yeah, what's up?
So you said there were 3 different types of inhalers. Do you have to have all 3, or do you choose the one that's best fit for you?
That's a really good question. So it depends on your severity of your asthma. For example, mine is really bad and I still experience asthma attacks like to this day. So I have a maintenance inhaler, a nebulizer, and my rescue inhaler. But there are a lot of children who actually outgrow asthma. So they usually just have the rescue inhaler and don't take like an inhaler on like every day. Does anyone have any other questions? Brandon?
So when you get over asthma, there is a part that you don't need to have inhalers anymore.
I believe so. Like I said, there are a lot of people who outgrow their asthma, so they don't have to take an asthma like on a daily basis. But I think it's always safe to have a rescue inhaler or a nebulizer at hand, just because you never know. Because like one of the common triggers for asthma is allergens. So if someone were exposed to like a food allergen like peanuts or seafood, like it could trigger them to have an asthma attack even if they haven't had it in a long time. Does anyone have any other questions? Anna, David, or Jamie, do you guys have any questions? David.
How long have you been dealing with asthma?
I have been dealing with asthma my whole life. I was born with it, and I have gone to many trips to the ER. I'm sure you're personally aware, David, because David has had to bring me to the emergency room because I had rhinitis, which caused my breathing to be really difficult, and I could barely, it kept me up at night. I couldn't complete any daily tasks. I could barely like walk a certain distance without getting shortness of breath. But it's definitely been less. It was controlled for a good amount of time, but that case of rhinitis really just, that's why I said, like, even though some people have grown out of their asthma, you never know what's going to happen. Does anyone have any other questions? Okay, awesome. I think that concludes my presentation. Thank you guys for listening. Okay, how do I